Good morning. My name is Krista Braun-Inglis, and I'm a nurse practitioner and assistant researcher here at the University of Hawaii Cancer Center. The project I'm going to talk about today is increasing oncology advanced practice nurse utilization in community cancer clinical research. So I joined the University of Hawaii in 2018, and I was really interested in getting oncology advanced practice providers, which include advanced practice registered nurses and physician's assistants, more involved in cancer clinical research. There's been an increase in advanced practice providers in the oncology world over the past 10 years. There's actually been an explosion of the amount of advanced practice providers, and we really provide most of the symptom management and care coordination for cancer patients on treatment. However, there hasn't really been an integration of us in Hawaii routinely into cancer clinical trials. So I set out this project was to increase our utilization and contributions to cancer clinical research within the Hawaii Minority Underserved NCORE. So what we did from 2018 to July 2020, 10 of us plus myself, so a total of 11, registered as non-physician investigators through the NCI as non-physician investigators, which is an advanced practice provider or graduate level researcher. We also changed policy at the University of Hawaii Cancer Center to allow oncology APRNs to serve as site principal investigators for cancer control, symptom management, and cancer care delivery trials. Third, we integrated APRNs into protocol review. So we looked at scientific and feasibility of each protocol that came through, and we really looked at this for the cancer control, symptom management, and cancer care delivery trials. And when I started this project, I really looked to what other institutions nationally were doing with advanced practice providers. However, interestingly enough, I did not find anything in the literature. So this group, myself and about 8 others, actually worked on developing a survey and validating it as a valid and reliable tool, and then eventually it was distributed nationally. So over the 2 years, we were actually able to increase the number of oncology APRNs registered through the NCI as non-physician investigators from 2 to 11, or an increase of 84%. We started oncology APRN serving as enrolling investigators. So when we talk about enrolling investigators, we enroll patients separate from our physician counterparts on trials that are specific to our practice, things like symptom management, cancer care delivery. We also increased the number of APRNs serving as site principal investigators, so total oversight for specific trials within Hawaii. We were able to look at 20 different protocols to review for scientific and feasibility within our NCORE during 2019. We were increased accrual at 2 institutions because of our involvement. We assisted with multiple cancer care delivery trials, and there was one that the APRN was so key in her role that we were able actually to make our accrual goal the first in the nation. We set up an award for an oncology APRN who has the most accruals. And finally, we piloted the survey, and we're able to validate that survey to disseminate to a national audience. In conclusion, oncology APRNs, we're interested and we want to make meaningful contributions to cancer clinical research. But however, we many times need more education to understand our role. We need to be weaved within the clinical research workflow, and we really need to look at policy within our institutions, because a lot of times there may be barriers to our full participation. So we've worked through those 3 issues within our NCORE and through this project, and we've been successful in getting APRNs more integrated into cancer clinical research. If you have any questions, please go ahead and feel free to email me. And thanks so much for coming to my presentation today.